Pneumonia is a form of chest infection that specifically inflames the air sacs in one or both lungs, which can fill with fluid or pus, causing a range of respiratory symptoms. Symptoms often include a cough with phlegm or pus, fever, chills, and difficulty breathing, which may vary in intensity from mild to severe. Other potential signs of pneumonia might include chest pain when you breathe or cough, fatigue, and loss of appetite. Treatment for pneumonia may involve antibiotics to fight bacterial causes, antiviral medications if it's viral, and sometimes antifungal drugs for fungal pneumonia, with the addition of rest and plenty of fluids to aid recovery. Risk factors for developing pneumonia include being very young or elderly, having a weakened immune system, smoking, or having underlying respiratory conditions. Here are detailed aspects of pneumonia as a representative chest infection, delineating its implications and potential measures for management and prevention. Infectious agents, bacterial versus viral. Pneumonia and chest infections often present similarly with cough, fever, and difficulty breathing, but a key differentiator lies in the infecting agents. Bacterial pneumonia, typically caused by Streptococcus pneumonia among others, often leads to more severe symptoms rapidly and can be treated with antibiotics. In contrast, viral infections like influenza or respiratory syncytial virus, RSV, might show a more gradual symptom onset and are not responsive to antibiotics, instead relying on the body's immune defense and supportive care. Identifying the causative agent informs the treatment plan and plays a vital role in patient recovery and the prevention of disease spread. Cough productivity, mucopurulent sputum versus clear or white phlegm. While evaluating a cough's productivity in diseases like pneumonia versus other chest infections, the characteristic of the sputum can be telling. In bacterial pneumonia, patients often present with mucopurulent sputum, which is thick, colored, and sometimes blood-tinged due to the inflammatory response in the alveoli. This may indicate a more localized infection where the body's immune response is pronounced, leading to the collection of pus-producing cells. On the other hand, chest infections like viral bronchitis might produce clear or white phlegm. Such phlegm is thinner because it primarily consists of water and various proteins, which reflects a different immune response. Commonly, a more widespread inflammation along the airways without localized pus formation. Assessing sputum can guide clinicians towards tailored treatment, with the need for antibiotics being more prominent in bacterial causes like pneumonia. Duration of illness, weeks to months versus days to weeks. When considering pneumonia versus a more general chest infection, the duration of the illness is a key distinguishing factor. Pneumonia, an infection of the lung parenchyma, is typically characterized by a more prolonged course, often extending over a period of weeks to months. Symptoms, such as persistent cough, chest pain, fever, and difficulty breathing, may not resolve quickly and can linger, reflecting the time it takes for the lungs to heal after the alveoli have been inflamed and filled with fluid. Conversely, a milder chest infection, like acute bronchitis, usually manifests with similar but less severe symptoms and has a shorter trajectory, commonly resolving within days to weeks. Early and accurate differentiation is crucial to ensure appropriate treatment and monitoring, which could include antibiotics for bacterial etiologies and supportive measures such as hydration and rest. Fever presentation, high and persistent versus mild or absent. When distinguishing between pneumonia and a milder chest infection, such as acute bronchitis, fever presentation can be a significant factor. Pneumonia is often associated with a high and persistent fever, underlining the body's systemic fight against infection that has reached the alveoli, the air sacs in the lungs. This type of fever usually doesn't wane without appropriate medical treatment. On the other hand, a chest infection limited to the upper respiratory tract or bronchi might induce a milder fever or even no fever at all, reflecting a less intense immune response. Symptoms like the severity and persistence of fever provide clinicians with essential clues for an accurate diagnosis, guiding them in determining the right course of action, from prescribing antibiotics to the necessity for hospitalization. Chest sounds, Rales or Crackles versus Wheezing or Rhonchi. Pneumonia and chest infections such as bronchitis can often be confused as they share similar symptoms, but auscultation of chest sounds can help in differential diagnosis. Pneumonia often presents with Rales or Crackles, which are short, high-pitched sounds heard during inspiration, caused by the opening of small airways and alveoli collapsed by fluid or exudate. On the other hand, chest infections like acute bronchitis may present with wheezing or Rhonchi, continuous, low-pitched sounds that occur when airways are narrowed or obstructed, often by mucus, and are typically heard during expiration. Being able to distinguish between these sounds can guide healthcare providers to a more accurate diagnosis and appropriate treatment planning.